Good afternoon. Thank you all for being here. I have a little cold, so excuse my voice for this afternoon. I'll start by describing this year's rate review process, provide the results of the Commerce Department's review of the health insurance companies' rates, and lastly, announce my plan for rate reforms. First, let me take a moment to thank my staff who worked on the rate review. Christy Bone, our Chief Health Actuary, Fred Anderson, our Chief Life Actuary, David Sexton, our Actuary Associate, Lindsay McLaughlin, Health Policy Advisor, Melinda Domzowski-Hansen, our Health Policy Coordinator, Candace Gergen, the Filing Analyst, and Melanie Milbert, our Actuarial Analyst. I'm grateful for my staff's hard work. Over the past 5 months, they've done a great amount of work, putting in long hours on behalf of Minnesotans. Joining me today is Allison O'Toole, the Interim CEO of MNsure, who will talk about tax credit benefits. Also, we have staff from the Department of Health to answer any questions for them as well. This year's rate review process was similar to prior years, but very different in some important ways. Our overriding goal is to have a competitive and healthy insurance market for consumers. The primary function of the insurance rate review process is to protect consumers from rates that would be excessive, leading to high profits, and from rates too low to pay for policyholders' claims and avoid financial insolvency of insurers. Under the rate review law, the department must approve the insurance company's rates if the company demonstrates they are actuarially justified. Fundamentally, the rates proposed by the insurance companies must pay for expected policyholder claims and expense for providing the insurance. By law, rates are determined by each market segment. Today's rate announcement are for the individual health insurance market and the small business or small group health insurance market. As in prior years, Commerce conducted a thorough review and scrutiny of the insurance rates. Commerce is recognized as one of the best departments in the country for strong and effective rate review. Commerce carefully reviews all proposals by the insurers to make sure that they comply with Minnesota's rate and policy coverage requirements. Our actuaries and analysts have reviewed the complex math, the projections, and proposed policy language for compliance with Minnesota law. In addition to Commerce, the Minnesota Department of Health checks to ensure the plans comply with medical network requirements. With me also today is Dan Pollock, the Deputy Commissioner at the Minnesota Department of Health. As I mentioned, this year was unique in some very important respects. In prior years, proposed rate filings were kept confidential during our review to protect the competitive process and to avoid having the insurance companies file changes for increases. This year, for the first time, proposed rates filed higher than 10% were made public in June according to federal law. This made the department's rate review more difficult. When Blue Cross and Blue Shield filed high rate increases in the mid-50% range, it made all the other insurers want to change and increase their rates too. This effectively tied our hands in some respects due to the great pressure to increase rates. Another difference this year, we are announcing the entire individual market instead of just MNsure for the exchange. And finally, this year was also unique because we received comments from the public about the proposed rates. This was very helpful to hear from the public. I've read them, and we'll discuss them later. Today's rates announcement has mixed news. Let me start with some good news. In a bright spot for this year, rates for small businesses, known as the small group market, will increase only slightly in 2016. In contrast to annual increases of 7 to 10% that were typical just a few years ago. Also, with all of its health reform initiatives, Minnesota has succeeded in increasing the percentage of Minnesotans with health coverage to an all-time high level of about 95%. Now, you all should have the rate release information in your packets that my staff distributed earlier. Even though rates in the individual market are rising, as you see from the rate summaries, and some very high rate increases, Minnesota's rates will stay among the lowest in the nation and the lowest among neighboring states in the upper Midwest. To be clear, the rate increases announced today will not affect the majority of Minnesotans. They apply only to plans in the private individual insurance market, whether through MNsure or directly from an insurance company or agent. These rates do not affect the nearly 95% of Minnesotans who have coverage through employer-based plans or through public programs like Medicare, Medicaid, and Minnesota Care. Many Minnesotans who purchase their individual insurance through MNsure will be eligible for federal tax credits that lower their monthly premiums. Only policies purchased through MNsure qualify for the federal assistance. Allison O'Toole is here to talk more about MNsure and the tax credits after I'm done. What can consumers do about rising rates? The most important thing consumers can do this year to deal with the rising rates is to shop for a lower price plan that still meets their needs. I encourage all Minnesotans to shop around for the best company and coverage for their health care needs. I can't say this enough. If your rates are going up too high for your family budget, then shop. Even though Minnesota rates remain among the nation's lowest, the rate increases by the insurance companies are unacceptably high. Minnesotans are asking why the companies have gone up so high. Here is what the companies are saying about their rate increases. According to their data, the rate increases in the individual market in Minnesota is mainly the result of continuing high number of costly claims and the underlying cost of health care. In essence, the individual insurance market appears to have sicker, more costly patients, and the prices charged for health care services and drugs are rising overall. Indeed, another factor appears to be related to high costs of medicine, which even recent news has noted have skyrocketed, in some cases by outrageous price manipulation by drug companies. As a result, the companies report that the majority of the individual market is incurring losses. Insurers have paid out more money for medical claims than they have taken in from the premiums they charge. Moreover, federal rate stabilizing programs will be ending after next year, and remaining stability mechanisms will be insufficient for Minnesota. So today, I have a plan. The individual market is not working as well as it could be. Minnesotans expect and deserve better. Here's what Minnesotans are telling me in their public comments. Ed and Sue from Perham, who are self-employed and buy a policy on the individual market, wrote saying, "Isn't there anything that can be done to protect us on the individual market from such horrible premiums? Since the implementation of MNsure, my husband and I haven't qualified for the premium supports." Thank you, Ed and Sue. While many more Minnesotans will qualify for tax credits on MNsure this year, not all will. So one of my key reforms is rate stabilization. Minnesota needs to create new state-based market stabilizing mechanisms to hold down future rate increases. State-based mechanisms should include: 1, a new reinsurance type program for the individual market that provides a backstop, spreading the risk so that insurers do not raise rates to cover large claims. And 2, risk adjustment mechanisms that spread the financial risk that insurers bear when they have more high-cost enrollees. Deb from Gaylord is a small business owner, and with her husband, bought an individual policy. She said, quote, "We have always purchased health insurance, even when not mandated, and now are being penalized. Our policy has a high deductible and only covers preventive measures. What are consumers to do? I don't feel bad for Blue Cross Blue Shield. Maybe check how much their CEOs and top executives are making before passing the buck." I agree with Deb. Insurance companies should not accumulate excess profits on the backs of Minnesotans who need affordable health care. I've instructed my staff to take a deeper look and carefully examine the insurance company's reserves and profits, and to look at a cap to prevent excess reserves. Next, Lori from Minneapolis wrote, "Why are individual policyholders being singled out for huge rate increases while employer-sponsored plans are not sharing the burden of increasing health care costs? I realize rates must increase. However, shouldn't there be a ceiling amount each year as to how much rates are allowed to increase?" Lori makes an interesting point, but at a minimum, Minnesota needs public policies that foster greater price transparency and cost competition to keep rates down among insurers and healthcare providers. You should be able to afford insurance and afford to use it when you get sick. Finally, Dave from Prior Lake said, "If Blue Cross Blue Shield has to make up a deficit, wouldn't it be fair to ask all their insurance holders to chip in? By that I mean all group plans, etc. Then the rate increase could possibly be in the single-digit range if all share in it. To single out one group of holders to bear the burden is simply unfair." Dave raises a very good point. We need to carefully study and decide on whether to take the option of merging the individual and small group markets. There are various reasons for and against merging these markets. However, the rates in these two markets are converging, and by expanding the pool size of the individual market to include healthier populations, merging these two markets would likely provide some additional stability to the rates. At this time, I'm asking the newly formed Minnesota Healthcare Financing Task Force to take up this rate stabilization issue, appoint experts to review them with the help of the Department of Commerce, and to recommend any legislation needed for this next session. Minnesota has always been a leader in healthcare reform, and it must continue to lead the way. To recap my plan to stabilize rates, we need, first, a Minnesota price stability mechanism. 2, looking deeper and examining insurers' reserves and profits. 3, policies that foster price transparency and cost competition. And 4, carefully considering the option of merging the individual and small group markets. With these and other steps to implement them, Minnesota will stay ahead of the curve. Thank you. And now I'd like to turn it over to Allison O'Toole, Minnesota's Interim CEO, for some brief remarks.
Thank you, Commissioner Rothman, and good afternoon. I'm Allison O'Toole. I'm the Interim CEO of MNsure. The Affordable Care Act was passed and MNsure created in large part to promote market transparency and provide financial help to consumers like advanced premium tax credits to help make insurance more affordable. This is especially important in light of today's news. Large increases are always unfortunate, but MNsure offers a real solution for Minnesotans to help control and even eliminate these premium increases. MNsure is the only place for Minnesotans where Minnesotans can go to take advantage of advanced premium tax credits. These tax credits immediately lower a consumer's health insurance premium, acting like an instant discount off the monthly premium. So in light of today's news, I encourage Minnesotans to come to MNsure and shop and compare plans. For those who don't, you're potentially leaving money on the table. And I'll give you a few examples. A 40-year-old in southeast Minnesota purchasing a silver plan could see a rate increase this year from $282 a month to $329 a month next year. That's a $47 a month increase. But that same person would see their advanced premium tax credit amount increase from $159 a month to $209 a month next year, meaning the overall cost to the consumer will be less in 2016. A 25-year-old in the Twin Cities could see her bronze plan rate increase from $110 this year to $140 a month in 2016, a $30 a month increase. However, the tax credit amount through MNsure would also increase from $20 a month to $59 a month, meaning an overall savings of $9 a month for the consumer. And finally, a 60-year-old in western Minnesota in Yellow Medicine County could see his tax credit increase from $360 a month this year to $514 a month next year, and could purchase a bronze plan for only $11 a month. These are just 3 examples of the dozens of ways Minnesotans can find relief from these increases. About 55% of current MNsure enrollees receive an advanced premium tax credit, and I expect that percentage to increase next year. In 2014 alone, Minnesotans saved $31 million in tax credits. That is real money and real savings for Minnesotans. Today's rates release gives consumers the needed time to evaluate their options ahead of the open enrollment period, which starts November 1st. And it shows how important tax credits are to mitigating these increases. And these tax credits are only available through MNsure. So I'll recap what this means for Minnesotans. Minnesotans concerned about their rising premiums should come to MNsure at the start of open enrollment on November 1st to see if they qualify for financial help. They should shop and compare plans so they can choose a plan that fits their needs. MNsure is the only place that provides Minnesotans financial help to offset these premium increases. And MNsure is the only place to do an apples-to-apples comparison of the 100 different plans available this year. And in fact, we have a new comparison tool that will help consumers do just that. Bottom line, it pays to shop. Before I pass the podium back to Commissioner Rothman, I'd like to thank the MNsure staff, specifically Kristen Kelly, Angela Benson, and Shane Delaney, for their hard and very quick work today to prepare all this information for all of you. Great work as usual, team, and thank you. Commissioner Rothman.
At this time, I wonder if there's any questions.
I'd like to go back to Ms. O'Toole, what you were just talking about. Do you have an idea of how many more people will be qualifying for subsidies, and thus some type of an idea how many people might see a decrease from 15 to 16 because of that?
I don't have those exact numbers. It really differs from person to person, but that really highlights the importance of people coming back to shop and compare. Everyone has a different situation, and it pays to take 20 minutes to find out what they qualify for.
What is the difference between Metro and outstate Minnesota? Perhaps, Ms. O'Toole, you will have those numbers, won't you?
We have some of them, but I defer to
Who has
Commissioner Rothman.
Who has all of it? Can you compare the rates for the metro area versus the rural areas?
We can give you the exact information, and overall, the rates are going to be the same. The rate increases that we have put in our packets. I don't have a packet with me. Wait, I do. But they're 49%. Yeah, those are going to be the rates across Minnesota, roughly, give or take some percentages. But they're not going to differ according to rating areas.
Your job, you said at the beginning, is to approve the rates, regulate this, if it can be proven by the health companies that they deserved it. Do they?
What I said was, Pat, that under the law, Minnesota, the companies have to demonstrate that they are actuarially justified, meaning they've provided the evidence to our actuaries to support the requested rates. We objected to all of the rates across the board when we went through the process, making sure that we got every ounce of information we could from the companies to explain why they needed these rates. In some instances, just take, for example, Blue Cross Blue Shield, their rates were in the mid-50s. We squeezed out everything we could that was not, that was not actuarially justified. And to the extent there was no evidence to the contrary, that's what the companies established.
So you believe these are justified? You have, as a regulator, determined that these rates are justified?
What our actuaries have determined is that the companies have presented actuarial information to support their request and that they were actuarially justified.
But you don't believe it?
Well, I said this before. I think that the rates are unacceptably high. I think the rates need, for many Minnesotans, the consumers I talked about earlier, cannot afford these kinds of rate increases. I explained that the reason why rates have gone up, according to the insurance companies, is that the number of large claims, sick individuals, and the high cost of medicine and services are driving these rates up. And most importantly, I'm calling for rate stabilization. And I think it's very important and it's imperative that Minnesota adopt all of these price stabilization mechanisms. Number one is to do reinsurance program or some sort of risk adjustment program. Number two, we're going to keep a very close eye on the profits and reserves of the companies. Number three, it's imperative that we look at price competition and the underlying cost of health care to make sure that they're transparent, because the insurance rates are built on how much it costs for insurance. And if we can keep those costs down, like Minnesota has over the years, and we've always been a leader of health reform, it's great. And finally, Pat, I think it's imperative that we look at spreading the pool, meaning we need to look at merging the individual and the small group market, the small businesses.
I understand what you're saying. You've told us this before, Commissioner. I'm just a farm kid. Maybe I don't understand. You have said you object to this. It sounds like you're saying you were forced by law to approve these rates, even though you don't think they're justified.
What I've said, Pat, again, is that the companies presented the evidence that established that they were actuarially justified to their extent. We looked at them and objected. We reduced the rates when we could. And as I've said, I believe the rates are unacceptably high. And I've called for reform so that we can stabilize these prices.
Let's go back to Pat's first question.
Yeah.
Are you saying that each area is 14 to 49% increase, or that's just a statewide number?
It's the statewide number, but it won't vary among the rating areas around the
Each area is
city.
14 to 49.
Right, yes.
Okay, so how does the rate compare, the actual rate, not just the increase, actual rate compare now, the Twin Cities versus the other areas? These are differences, I assume, area to area.
There are differences from area to
How
area.
much difference is there?
Well, I'll have my staff get you the details on all of that. I can only generalize because we haven't prepared that information for today. But generally, the market in the metropolitan area, because there's more population and all of that, has had price competition and rates. There have been areas and pockets in some parts of the state, like we call it Rating Area 1 and others, where they have seen, for lack of competition and because of the price and the cost of healthcare in those areas, higher rates than other areas. And if I can take this opportunity, again, for any area and for any place in Minnesota, the most important thing Minnesotans can do if they are concerned about the high rates increasing or any rates whatsoever, is shop to a cheaper plan. Look at a different company. It's imperative that you do that and take advantage. Take another look, try it again, check to see if they can qualify for the tax credits on MNsure.
And one more on this. As I understand, every Minnesotan will have a choice between 6 companies now? Is that right?
I believe it's 8 on the individual marketplace.
Well, in every area? I thought some were 6.
Some are less. So in some areas it's 2, and in some areas it's more.
Okay, so I haven't had time to memorize.
Well, it might be 3, 2 or 3 in each, at least 2 or 3 in each area.
Is that an improvement from the past?
It's the same as last year. Nothing has changed with respect to the number of health insurance companies participating in the market, both on and off the exchange.
And that's true for every area?
Yes.
Commissioner, was the elimination of MCHA a factor in the rate increases?
Yeah, well, the elimination of MCHA, Tom, you've put your finger on a very important point. And that is that when the federal law prohibited assigned risk plans across the country, including Minnesota, Minnesota had to eliminate the MSHA program, which was a program for the high-risk individuals. It was about 26,000 people. So beginning in 2013, under legislative authority, the department has moved those folks off of MSHA and currently are now have been merged into the other markets. They could have qualified for Medicare, Minnesota Care, the individual marketplace, or anything else. But because of those high risk individuals, that would be one of the factors. And one of the reasons why I want to carefully study the markets.
And given the fact that the increases for the insured, what they're getting in 2016, are they going to lose big money again this year? Do you know that?
It's my expectation that the companies, based on the best information they have for these rates, have proposed actuarially sound projections. And to the extent that they're correct, we'll have to see. But I can't predict the future. And when we get to this point next year, we'll take a look and see how it turned out.
You're proposing a reinsurance program. Is that a state-based reinsurance program in your mind?
Yes.
So you would have to come to the legislature and ask them to put up money to send back to insurers if claims come in too high?
Well, what I'm proposing is a reinsurance program. There are different ways to pay for it. The reinsurance program would basically pay for the high claims in the marketplace and alleviate and spread that risk, actually, creating more certainty and price and rate stabilization in the rest of the marketplace. How it's paid for, I'm going to leave open. There's various ways to do that. I would just, point out an example. We have the Workers' Compensation Reinsurance Association is set up as a reinsurance price stabilization mechanism for the workers' compensation system in Minnesota. But that's just an example.
And you're also advocating to study merging the individual and small group markets.
Yes.
Republicans this past session proposed eliminating Minnesota Care. One of the benefits was that, a lot of that population would probably move into the individual market. Is that something that you also think should be on the table?
No.
Why is that?
Well, the Minnesota Care program overall is a terrific program for working class Minnesotans. It's good coverage, it's efficient, it delivers terrific coverage for people, and I think for those people, it's a good thing. But I should also say that the health care task force that's currently looking at things is trying to figure out this question of the health care continuum between Minnesota Care, Medicaid, the individual marketplace, et cetera. So it's something that's being looked at. It's a fair question. But at the same time, I'd say no at this point, from my perspective personally, and that what we need to do is look at how to stabilize the individual marketplace in Minnesota.
If I see it correctly, it looks like there are no more platinum policies on MNsure. Is that right?
That's correct.
Is that a problem? And there are some off the exchange still, right? What's happening? Are carriers taking the on-exchange products and moving them off exchange? I don't know. Platinum in 2014 was really popular, but now it won't be part of the exchange. But what do you make of that?
Well, first of all, you're correct. It's the submissions of the health insurance companies. These are the plans and, bronze, silver, gold, et cetera, for what they proposed for the state of Minnesota, both on and off the exchange. So I'd ask them. It's their business plan. They decided. They made these decisions.
I mean, I don't know if Allison knows it, but I mean, last year we preferred the dynamic, and two other carriers. There were policies moved from on to off exchange. Is there much of that this year? Where people, if they want to maintain their tax credit, they got to proactively shift to a different plan?
I'll have Allison.
Yeah, happy to. Thanks, Chris. Good question. We do see some shift like that, not nearly as large as it was last year, but there's about 9,500 Minnesotans who are going to be in that same situation. So it's particularly important for those folks to come back in and shop. I mean, I sound like a broken record here. But it is critical for Minnesotans to shop and compare this year and see if they can save money.
Ms. O'Toole, if I may follow up on that.
Sure.
Do you know how many qualifying patients last year were in the platinum plan that now have to shop for new policies?
I don't, but we can follow up and see if we can't get you that. I don't know it off the top of my head.
Do you know, so the split of the individual market on and off exchange, I think it's about 80% off, 20% on, something like that, is that right?
Generally, I've got the information back here specifically. I can give you the exact numbers, but it's generally this. There's nearly 300,000 Minnesotans in the individual marketplace, and the exchange is approximately 50,000, so it's about 1/6.
Do you have any way to know what share of folks buying off the exchange would qualify for tax credits?
Off the exchange?
Yeah, if they bought on MNsure, they would get
Well,
tax credits.
let me say a couple of points about this. First of all, anybody can buy through the exchange. And I encourage everybody to take a look at the exchange to determine whether or not they are eligible for the tax credits. Because, as Allison indicated, they can dramatically help with respect to the premiums. So if you haven't before, you should try. And if you are currently, you definitely need to make sure that you're doing the right thing for yourselves this year. And most importantly, for those people who have concerns about the increased rates for their particular company, they should definitely shop and take a look at another company and their plans.
So if platinum plans have gone away from the exchange anyway, does that affect the percent of increase? Does that mean that because the platinum, the more expensive plans aren't there, that they have a lower premium increase than they would have otherwise if they kept platinum? I'm sorry, I'm a farm boy too. That's the excuse today. Platinum
I'll
plans.
let you have another shot at it.
Platinum, thank you. Platinum plans are usually more expensive. So they are more expensive, were more expensive. Since they're not being offered, does that mean the total premium increase, the 14 to 49%, is lower than it would have been if the platinum plans would still have been offered?
I don't know of a way to predict, to answer that question, because basically the way it works is you decide what the plans you're going to do, bronze, gold, whatever, and then price that according to what you expect that to cost. And if and fundamentally, I think the answer to your question is that the platinum plans were at a 90% actuarial value, meaning the companies had to deliver 90% of the value to the policyholder consumers, and 10% would be left over for them. So then the question is, well, who was shopping for them? Who was using them and all of that? And then the companies made a business decision with respect to this year.
Let me put it another way.
Yeah.
Are the gold plans being offered for 16 comparable to this year's platinum plans, or are they do they have lower coverage?
You know, I'll check. For gold plans that were offered last year compared to this year, they all have to still comply. They have to have an 80% actuarial value to them. They have to provide the essential health benefit set coverages. And as to the rates, we can provide you the information on the gold plan rates on the exchange. And you could take a look at what they were compared to last year, but we didn't do that
For the
comparison.
coverage, are you saying the coverage would be the same next year as is this year on gold?
Approximately the same.
Okay, so you've lost all those platinum plans, which would be more expensive.
On the exchange.
On the
There are
exchange.
some being sold, they're being sold off the exchange.
Same number off exchange?
I don't know if we've lost any, but we can, I can answer that. We have the information.
Seems like, again, as farm boy, seems like the rates would have been much higher if the platinum plans had been offered, both on and off exchange.
The only answer I can give you is that if they had been offered, they would have had to price them according to the information,
Which would be higher
which would have been,
than they are now.
they would have been, you know, approximately. I'd say generally, the answer would have to be, the platinum plans for this year would have been higher than they would have been last year.
So I guess to follow up on
But
Don's.
they're not being sold on next year.
Excuse me, to interrupt. To follow up on Don's question, are consumers who are enrolled in these plans now getting worse coverage at a higher cost than they were in 2015?
You know, the consumers are choosing individually themselves. A lot of them are on bronze, a lot of them are on the silver plans and all of that. And they have to decide whether they're going to keep them or not. For those who, if you were on a platinum plan on the exchange last year, and you wanted to keep a platinum plan and stay on